Welcome everyone to Learning Unit number 3, where we're going to be talking about incorporating mindfulness into our lives and about the stigma that surrounds mental illness. And by the end of this module, you're going to be able to analyze the impact of stigma on people, on an individual with symptoms of depression. And you're going to discover that there are ethical concerns that may arise with the knowledge that there is a correlation between nurses with suboptimal mental health, especially with depression and anxiety, and an increase in medical errors. And we're going to be able to implement a mindfulness practice as a strategy to support good physical and mental health in our personal and professional lives. So you're going to do a couple of things this learning unit, and they all build on one another. So I ask you to please do your very best to complete each learning activity. The first one is reading chapters 2 and 3 in your text, The Mindful Nurse. And I think you're finding with the Start Last learning unit that this textbook is probably going to be one of the most enjoyable to read throughout your nursing program. Then you're going to register for the Institute of Healthcare Improvement on the left-hand tool tab that you don't see right now, but is on your Blackboard course, is a link to the Institute for Healthcare Improvement, the IHI. And on that link, there's information about how to register if you've not taken one of these modules before. It's totally free. It takes you about an hour. And specifically, you're going to register for IHI Open School, and then you're going to complete one of their learning modules. And that's PFC 103, Incorporating Mindfulness into Clinical Practice. Once you're done with that, you're going to be given a certificate of completion of that. If you have difficulty finding your certificate of completion, at least do a screenshot and post that. That demonstrates that you've completed this module through the Institute for Healthcare Improvement, and you're going to upload it to this Dropbox. Then I ask you, one of the best ways to really understand depression is when you look at screening questionnaires. And this is a one-page PHQ-9. There's 9 questions for screening for depression. It's very commonly used. It's valid and reliable tool. But I ask that you take the survey yourself. You don't have to share any score or anything. This is just for you to better learn about what the symptoms, the experience of feeling depressed is like. But also, I want you to be aware that if you are experiencing these feelings of depression, that you speak with your primary doc. And please know, the main thing is, as a student here at Mercyhurst, you also have free access to counseling that's confidential for both students and faculty. And you go through the Cohen Wellness Center. You can call this phone number. It's located right next to our bookstore. So it doesn't take much time, but it's an important questionnaire to be aware of, and I ask that you take it yourself and score it yourself. The next is a video. A young adult, Allie, talks about the stigma surrounding depression. So as we talked about, chronic illness is the experience of someone who's dealing with a disease or a mental illness. So depression, it's the experience of Allie that she's sharing with us today. So I ask that you watch this video. The next thing is, this is how we incorporate our mindfulness practice. Just do this 1 moment meditation. As you see, it's not 1 minute, it's 5 minutes, but it's within it, there'll be a 1 minute meditation. And it's just a real simple but clear way to begin our mindfulness practice. Then there's going to be two other readings for you. Again, very, very short. The American Nursing Association did a survey in 2021. They had been doing the survey annually so they can compare the results from previous years about, and what they found is concerning regarding nurses and depression. The rates of nurses who are experiencing depression went up significantly from 2020 to 2021. And so this is not meant to scare or alarm as much as it is meant to help us see the importance of learning coping strategies such as mindfulness meditation to maintain our mental health through our clinical nursing practice. And also there's a short study results from Melnick is the author from 2017. And this is a study that speaks to nurses with depression, the higher rates of making medical errors. So you're going to need to complete these two readings to best answer your discussion board. So based on the results of Melnick's study, an ethical concern is raised. Her study demonstrates that nurses with depression are more likely to make medical errors. And it's even more alarming when we see that the incidence of depression has gone up, especially with the pandemic. But teaching mindfulness can be one strategy to address this concern. So my question to you this week is, if you were a chief safety officer at your local hospital, what would you as that chief safety officer recommend to leadership at your facility? So what are your recommendations going to be and why? Knowing this information from Melnick's study and the American Nursing Association. So I'm the Chief Safety Officer at UPMC Hammett, and I'm speaking to leadership and what are the recommendations I'm going to make to leadership based on this information. And quiz 3 is going to test your knowledge of the readings for week 3. So while it's not timed, it does need to be completed in one setting. So just again, one of my favorite quotes is from Jon Kabat-Zinn. And it's more of a quote, more than a quote. It is a definition for mindfulness. And Jon Kabat-Zinn says it very clearly and succinctly. He says, mindfulness is paying attention on purpose in the present moment without judgment. So think through that again. I know we've talked about it before, but mindfulness is paying attention on purpose in the present moment without judgment. Have a good week.